DBS is unlike any other therapy. Deep brain stimulation is amazing science of medicine and technology that can be incredible on many aspects if done right and well received, but it is not a cure. After a long and thorough medical examination by a team of doctors and neurologist and neurosurgeon, the accepted candidates will prepare for going through the process of a brain surgery, where they are implanted the DBS, by drilling 2 holes on top of the skull and inserting leads deep in the brain, to be precisely placed in an area as big as a grain of rice, which sends electrical impulses, through implanted electrodes, to specific targets in the brain nucleus, for the treatment of movement disorders. A neurostimulator containing the battery and the controller is implanted below the collarbone, and an electrical wire will be under the skin connecting the battery and the leads, passing by the neck and behind the ear. Under the hands of the best neurosurgeons, after the healing process of 2 or 3 months, DBS should not be seen. The way DBS is meant to work, a neurologist will first test each point connections on each leads from both sides of the brain, creating a map of how a patient's brain reacts to the different current settings, at different voltage, recording the best and less desirable points. The best part is that with DBS, and probably unlike any other therapy and medications, just with a remotely iPad device the DBS is instantly turned on and those awful and terrible Parkinson disease symptoms are reduced to almost none. With the correct settings and with time, even medications can be reduced or even in some cases totally stop. The patient can now go back to a normal life, and even though DBS is not a cure, as Parkinson disease is still a progressive disease, with DBS they can look and feel normal. But the patient must recharge or replace his battery, similar to a pacemaker device. Today DBS battery can last 15 years or more. Although DBS can also give side effects with higher settings, like dyskinesia, but these can also be reduced or removed with higher or lower settings. The patient also has a programmer to change its own settings if needed, although keeping always in touch with his neurologist. The future of DBS is wide open. But DBS closed loop, for example, is when the device can read the brain waves with sensors and will self-adjust your speed settings up or down before the patient can anticipate. DBS can help with people with many different movement disorders, including Parkinson's disease, essential tremor, dystonia, and other conditions such as obsessive-compulsive disorder and epilepsy. But only a neurologist will know what is best for the patients.